Good afternoon, everyone. Thank you so much for joining us today on the Dade County Weekly Update. Remember, this is live and you can type in your questions anytime during this update. If you don't want to ask your questions during the live portion of this broadcast, you can always email us at info@dadecounty-ga.gov. Thank you so much for coming to the right place for the right information. Today, we have from the Cherokee Regional Library System, Lecia Eubanks and Marshana Sharp. We will also be hearing from County Executive Ted Rumley. If you know someone who would be interested in hearing from any of our guests today, go ahead and invite them to watch this live broadcast or even start a watch party so you can hold your own discussion. Remember that you can also watch this later on Facebook or YouTube, and sharing the links to our videos is really, really easy. Reminder to always check our calendar at dadecounty-ga.gov for any kind of upcoming events. I also want to remind you that tonight at 6 o'clock p.m. is the Dade County Board of Commissioners workshop and regular monthly meeting. This will be videoed by KWIN, and we will share it to our Facebook page. We will also share the link to the agenda in the comments below. We are still socially distancing for the Board of Commissioners meetings, so if you would prefer to watch at home, that is recommended. Of course, we will have available seating for about 10 people at this evening's meeting, in addition to commissioners and staff and press. Also, a reminder, the Department of Driver Services will be here next Monday. That's February the 8th. We do share those reminders the preceding Friday on Facebook and Twitter, so make sure to follow us on social media and select See First so you can see all of those great reminders. The Dade County Department of Public Health does have available appointments for COVID vaccine today and tomorrow. They have 23 available appointments left for the rest of the day today and 15 tomorrow. County Executive Rumley will be talking more about that later, but you can go ahead and call them to make your appointment. If you are 65 or older and a resident of the state of Georgia, you can call them at 706-657-4213. There has also been another important announcement. Again, we'll be talking about this later during our COVID portion of this update. But there has been an important news release from the Department of Health regarding the COVID-19 variant cases and their increase in the state of Georgia. It says the Georgia Department of Public Health is confirming there are now 19 cases of COVID variant B.1.1.7 identified in Georgia. This is the same variant discovered in the UK and in several other countries and U.S. states. So far, no other COVID-19 variants have been identified in Georgia. The B.1.1.7 cases in Georgia are individuals ages 15 to 61, 8 males and 11 females. The cases live in Metro Atlanta, Carroll, Cherokee, Clayton, Cobb, DeKalb, Douglas, Fulton, Gwinnett, and Paulding counties. The DPH is working to identify close contacts of the individuals and will monitor them closely. You'll hear the case numbers later today for February, but the CDC has said that this UK variant is likely to be the dominant strain in the U.S. by sometime in March, said Kathleen Toomey, MD, Commissioner of the Georgia Department of Public Health. She said, "We must ensure that we are taking every precaution right now to prevent transmission of COVID and to avoid a surge in hospitalizations and loss of life. The same measures used to prevent the spread of COVID-19 in Georgia are no different for this variant and are even more critical due to the UK variant being more contagious. Please wear a mask, maintain social distance, and wash your hands frequently." Information about this variant is evolving quickly, so we will keep you updated as they put out more information on that. So again, County Executive Rumley will be talking more about that later, and other information from the Department of Health, including how we're taking calls down in that in the Department of Health for the vaccine. Right now, we'll go to Lecia Eubanks and Marshana Sharp from the library.
Thank you, Carey, so much for having us. You know, I love to talk about our library, so I always love the invitation to come and do that. Well, if you have seen the Dade County Sentinel in the last week or so, you probably already know our big news. The Cherokee Regional Library System was named the 2020 Georgia Public Library of the Year, and we're very excited about this, and I just wanted to speak a little bit about that and all the wonderful things that you already know about our Dade County Library. But I just feel like this award being given for the year 2020 means just a little bit more. We all know what 2020 was like, and so it feels especially honorable to have gotten it in 2020. I think our library was already doing, our library system, we were already doing a lot of innovative things. We're always the first one in line to reach out and do those pilot projects from the state. We're always looking for grants. There's several grants going on right now in Dade County, the Next Chapter grant. We've got some art classes that are going on from a grant. So we were already doing those innovative things and always on the cutting edge, and that's wonderful. And I'm really proud of our library system for doing that, and especially here in Dade County. But I think what we did in 2020, we did for you because we know how important library services are to you. There were many of you who have the library as a lifeline. You reached out to us and asked us if we would find a way, and we were more than willing to. And I think we've got a really good set of protocols in place. We've not let ourselves get the COVID protocol fatigue, which is real. It's very real. And so we really work weekly. I stay in touch with all of my branches to make sure we're still following all the cleaning procedures that we need to, wiping down surfaces. The staff wears masks, shields, and we're doing all of that, and we will continue to do that to keep things safe for you all to be able to come in, and we can keep our doors open. We have curbside service, so all you have to do is call the phone. Marshana and her staff, they'll answer the phone. If you have placed a hold on a book and you don't want to come in, they'll bring it out to the car. If you don't really know what you want to read, but you've got an idea, call the library and tell them, pick me out of 5 mysteries. I need something to read. They'll do that for you as well. We've also found that during this time of COVID, where a lot of folks are having to work from home for the first time, and everybody I know everyone does not have internet, but let's say you have internet at home, but you found that you working from home, your children needing to do digital learning, that you just don't have enough bandwidth to get it all done. So you can come to the library. We do have gig speed internet. You can reserve one of our study rooms, and you can just sit in there, take care of your Zoom meeting or your Google Meet, and do it with some quiet, some private time. We're happy to help you with that. We've even got cameras that we can set up on your laptop or help you and assist you with any of those online meetings that you need to participate in. We've also stepped up to the plate in a lot of other areas. We've got a time with teacher tutor program that we were able to extend past December. The county commission was so good to us to give us some of their CARES Act money. They funneled some of it to the library so that we could offer this program, and that CARES Act funding pays the teacher, and these are certified teachers or newly retired teachers that are in the library ready to tutor your child in whatever area they need help. And all you have to do is go to chrl.org/tutor and click on the Dade County Library, and then read the list of available tutors that we have. You can read their specialty, what it is they're good at tutoring, and you can match that up with the needs that your child might have. You click on that tutor, their availability will come up, find an appointment time. We are booking 3 weeks in advance, and then schedule that tutor. You'll get an email reminder, the tutor will get a reminder, and just show up at the library and we'll provide the space. So we do have limited spaces available. I will say that, we're not filling up all of our spots, but then we've also have tutors that just have 1 or 2 nights they can tutor. So if you're interested in tutoring, and especially if you have a background in math, as you can imagine, that is one of the areas where our students seem to need help. I can relate to that. So if you are a teacher, a current teacher, or a retired teacher, and you have a certification in math of all ages, we would love for you to contact us, reach out to us. We'll plug you in these last few months. We are going to have this tutor program go through the end of May to get you through the school year. What we're doing, though, is we're looking for grants to hopefully extend this program so that we could start it back up in the fall. It's just really been amazing. We've created a feedback opportunity at the end of each week. Any student and their parent that has tutored for the week, they have the ability to comment, tell us if the tutor session was meaningful, give us any feedback. And we've just received so many comments on what it has meant in the life of their child. They see an immediate increase in their grade or a test that they took that next week. We've gotten so many positive comments. So we know it's something that's needed, and we're going to be looking for funding to extend that hopefully when the school year comes back in the fall. But for now, it's still available. If you need help booking that first appointment, go by the library. Marshana and her staff will help you do that. I know Carey mentioned Marshana was going to come up. She's here in the building. I don't know if she's going to come up or not, but I wanted to say, because Marshana won't do it, but I wanted to say how much I appreciate her and her willingness to always look for things that you need. And she is. She looks around this community and she tries to stand in the gap of whatever's needed here, and she helps identify those things, and then she comes to me and we sit down and we find a way to do it. And she has a willing staff that's willing to do it. They're all very attentive to your needs. We just love being here in this community, and we're here for you, and you know where to find us if you need us. So be sure and call the Dade County Public Library and talk to any of the staff members there for anything that you might need.
They're making me come up here. Thank you, Lisa. She said most of all what's going on right now. I will be at the county commission meeting tonight giving a report and have things that are coming up at the library. It is exciting that we won this award. The staff's excited, and the staff should be here tonight. So some of y'all that haven't seen some of them, they should all be here tonight. And actually, the library will be open, so I'll still be at the library for the first part of the meeting, but then I'll be here. And that's about it. Thank y'all.
Thank
I don't know
you.
what I was gonna.
Get this mask off here. Good afternoon, everyone. Hope everyone's having a good day. I'll go through some announcements here before I go into my report here as far as our COVID numbers. Carey covered a lot of stuff there a while ago. She was, and I'm going to get into the COVID testing with the health department and all, some of the things that we're doing to work with them to try to help this be smoother. I'll give you a quick update on County Road 6, as I did this morning on the Evan. We're on schedule with that. Everything's going good. They're making another pour today up on concrete. I'll just give you an update. As far as the time goes, it still is going to be, probably toward the end of February. Might bleed into March a little bit, but it's just got a lot to do with this February weather, and we'll see what happens. And that's on County Road 6 or White Oak Gap Road. The people always call it White Oak Gap Road, but in reality, it's County Road 6. There's been some talk, back a year or so ago, from about the bridge replacement over 136 at the high school. Well, I said it's talk. It's actually a reality here because they've got an engineering group doing the groundwork on that, and there's an ad supposed to be in the paper. I haven't seen it, but in the Dade County paper this week, and possibly I think they got to run it 3 weeks. And it's a period it's opened up for comments, and you need to really read this, especially if you live on the east side of the bridge over there, because it's concerning the actual the bypass that you'll be taking. If there's 2-3 different things we're looking at, and you need to call that number. It's in the paper. Ask questions. I'll get some information to Carey where she can post that online. This because it's, and then they will have come to this building here, and they will have a public hearing on it also. And it's not, that they're not asking us if they can replace the bridge. They're going to replace that bridge. But what we want them to do is do an expedited bridge, just like they did at the 299 going across the interstate. I think they're on board with that. But if that's the case, we'll be down probably anywhere from 14 to 28 days with that road closed, and that's 136, the main artery. So diverting the traffic on the other way would be go down and Creek Road. I knew that was going to happen. I thought I'd cut it down. I'm sorry. Anyway, get involved. Call and the number, voice your opinion, ask questions, and then the public hearing. I'm sure it'll be on that probably in March or April, and then we'll advertise that. So will but be sure to attend that also. Our unemployment statistics is good still. We're number 2 in the Northwest Georgia region with 15 counties. We're at 3.5. Walker's at 3.9, and Chattooga, they're really kind of hurting. They're at 6.4. It's one of the highest in the state in Chattooga County. Carey may have mentioned the driver's services. They'll be here next Monday, February the 8th. Put that on your calendar. The elections, I did announce this, I think, last week. They came to us, and they've actually the e-splosh will be on the ballot. That's the educational splosh for our schools only. It'll be Tuesday, March the 16th, when that election will be. That'll be the only thing on it, from what I understand, unless someone adds something, city or whatever. But that'll be the only thing that you're voting on. All the voting hours will be is posted on our website. I'm not going to go over all those, but the voting will be here, your early voting anyway, here in the administrative building. And then of course, the election day on Tuesday, March the 16th, you'll be able to vote at your local precinct. Just same as having a presidential election or any other election. So we'll be reminding you. Of course, Carey's got it online, and Evan too. There'll be a lot, I'm sure, about it between now and then. Our Dade County Sheriff's Office is still closed. The lobby is. The fingerprinting, they've made that available on Monday, Wednesday, and Saturday from 2 to 6. And if you have any questions about that, you can call over there and talk to them at 657-3233, area code 706. We will be having our monthly meeting this evening. Our work session will be at 6 o'clock, and then we'll go right on into our meeting. We are following strictly our COVID rules here, more so than ever. I meant to say this at first, but I got a call about 5 minutes before I came in here from Alan Bradford, just tested positive. So keep him in your prayers. He sounded terrible. So he just got his results back, and he called me just a minute ago, so he will not be here tonight. And so just be careful out there. I'm telling you, this is a lot of people's kind of relaxed a little bit more away from it, but I'm telling you, this time last month, I was in the bed. I didn't hardly know where I was at. It was really bad because I had to miss my commission meeting last month. So anyway, just pray for Alan, and the Tire Amnesty Day, which Alan's he's the quarterback on that. We had a date set, and it's the state. They changed it kind of to last minute on us. We will give you an update on a definite date. They've kind of given us a tentative date, but we're not going to go into that and say it, and then they change it again. But we feel it's not going to be just a few weeks, probably a month. Isn't that right? Roughly a month difference in it. 2 months. Okay. All right. But we'll keep you up on that. Move down to the COVID testing. We're still doing it. They're still doing it on Wednesdays. The drive-through here. They're not doing the fast test because of the vaccine that you're administering. They're just so busy with that, they could not do that. And that's not just here in Dade County. That's all the Dade, Walker, and Catoosa. We're working with. I'm going to try to work with the Rome people, our Rome Regional, which is where our health department works out of. When we start this second phase, what do you call it, Carey?
1A.
1A.
And then 1B.
So we're in 1B right now, right?
We're on 1A.
1A. But when we go to 1B,
Yes.
that's gonna be another wave of people coming in, because there'll be a whole different group of people, the essential workers and all, which will bring in all of our people that actually work in our industry here in Dade County, and it's just going to be a tremendous amount of people coming in, and we hope to have, if we can work with them, and we'll have maybe a little bit better call center to help them out downstairs, and possibly may have another building, maybe do a rapid, or maybe a drive-through of some type, or have a larger building that we can use where it'll go smoother for those people downstairs. Because I got a feeling that they will not give them any more staff downstairs. I mean, they're limited to our professionals. They've got a lot of volunteers, and thank goodness that people that's retired, they've come back helping them, that actually is qualified to administer the vaccine. But what we're trying to do, as we have in the last week or so, is try to staff people down there to answer the phones and just do whatever they need. Just try to help them. We got our churches and groups that are bringing them food, and that helps them a lot. I know they've been really appreciated of that. But there's a lot more we're going to try to do for them to make it smoother, not only for them but for Dade County, for you. So we'll keep you up on all that. It's going to be. It'd be big news. I mean, it's just because people, I said some of them are kind of relaxed, but there's a lot of people that are not, and they're scared. They realize that this is real, and they are not 65 and over, but they realize, hey, and people around me here, getting it at my age. So, please just keep up with Carey's, our website, and tune into to KWIN and to our briefings that we have, and we'll let you know kind of what's going on.
And it is the governor who sets those phases.
That's right. Oh yeah, the governor. It's one person. The governor's a man. He could actually tonight. He could call a press conference this evening or Friday. He's good to do that on Fridays, but he could change it. And could change in a minute. So we just want to be ready to help any way we can to make it a smooth ordeal for you. And it is an ordeal. I mean, people. I didn't realize there was that many people 65 and over in Dade County. But Evan mentioned this morning, I had not pulled the numbers up, but didn't he say we were like 50%? 50% of our supposedly 65 and over age group in this county, and that's taken from the census so far have actually gotten their shots.
And if they'll call the number downstairs, 706-657-4213, they'll tell them what's in phase 1A, 1B, and 1C. Yep. And then I know what they've been telling them downstairs is, just to tune into the weekly updates, and we'll tell them when the governor changes that. Right. But that is the governor's call. That is not,
it's
not our
ours,
call,
that's for sure.
not the health department's call.
And another thing too, some of you have called about this, but the primary health care, and that's a whole separate thing from our health department. But we're letting them use the parking lot down at the Four Fields or the sports complex, and they were there this morning. They'll be there till 5 o'clock, and they're taking appointments also. So if you're a patient then or whatever, give them a call or wherever you're more comfortable to go. One thing about it down there, they do strictly a drive-through. You don't come in the building or any building at all. You pull in and you drive through, then you park for 15 minutes and they monitor you. Then you can go on your way. And they've been accommodating down here, but it's really hard for them to do that. They can't do every person that way. They went out and administered the vaccine to some people that really can't walk or can't come in. If they came in, they'd almost have to bring them in on a stretcher. So they've really been good downstairs, but they're just not. They don't have the manpower or the woman power, both, but to go out and do that. So, but the primary health care, and do you have that number listed? Do you have a primary?
I can look it up right.
Well, no, I mean, it's something we ought to post though, because it's not like they're competing against each other. It's the same, they're doing the same thing. They got the same goal, and they're trying to make this thing work. And and both our health department and both our health department and primary are using the how you pronounce that? Moderna vaccine.
Moderna
I've had some people ask that, but
yes,
that
and if
is,
they get the Moderna first, they have to get it second.
Oh yeah, you can't mix it. I mean, wherever you get it. I mean, you've got to, when you go back to that number 2 shot. If you get Moderna, you need the number 2 needs to be Moderna. That's real critical that you do that. And Carey's got all of our numbers listed downstairs, and she'll go ahead and post the primary, I'm sure, for that too. Let me see if there's anything I left out. There's quite a bit to talk about here. Well, if you have any questions, you can call myself or call Carey, and we'll, if we told you about the driver's license, it's like I've covered everything. I'll go into our numbers here. Right now, our Dade County number, we are at, from the beginning till now, we're at 979 in Dade County that's had that's tested positive. We were at 933 last week at this time. We've had 75 people in 14 days in the last 2 weeks test positive here in the county. we've had 8 deaths, and so far we've had 47 hospitalizations. Walker County, last week they were at 4,972, and this week they're at 5,226, and they've had 406 test positive in the last 2 weeks. Catoosa County, they went from 4,369 to 4,601, and in the last 2 weeks, the last 14 days, they've had 388 positive tests in Catoosa. Chattooga County, they were at 1,930, and this week they're at 1,973. In 14-day period, they've had 106 tests positive in 2 weeks. Whitfield County went from 13,218 to 13,574. They've had 835 positive tests in the last 2 weeks. A lot of people. Of course, Whitfield's a big county. Gordon County, they went from 5,084 to 5,313 as we speak. They've had 373 in the last 2 weeks. Floyd County, they went from 8,394 to 8,696. They've had 586 in the last 14 days. There's still 3,091 addresses that's not been tied to the counties. We've had 12,970 deaths since March, since this thing started. That's up from 12,135 just last week. Let's move down to Tennessee, Hamilton County, our neighbor. They went from 36,369 cases to 37,462 in a week. They have 1,449 active cases as of today, but they've had 35,628 recoveries out of that 37,462. That's a lot of people. I mean, but of course Hamilton, that's very populated. They've had 385 deaths. Marion County, last week they were at 2,382. Today they're at 2,418. They have 71 active cases as we speak. They've had 2,309 recoveries and 38 deaths. Grundy County, they went from 1,449 last week to 1,490. They have 64 active cases with 14,001 recoveries out of that 14,090. They've had 25 deaths over in the Grundy County. Sequatchie County, they were 1,431 in Sequatchie County last week. And today they're at 1,472. They have 59 active cases. They've had 1,391 recoveries and 23 deaths. Moved down to Bradley. They were at 11,378 last week. They're at 11,696 today. They have 525 active cases, and they've had 11,049 recoveries out of that 11,696, and 122 deaths up in Bradley County. Move down to Alabama, go to Jackson County. Last week they were at 6,171. That's from back in March when we started this. Today they're at 6,333. They've had 77 deaths in Jackson County, and in the last 14 days they've had 473 cases test positive in Jackson County. DeKalb County, last week they were at 8,052. This week they're at 8,214 with 148 deaths. They have 441 cases. They've had 441 cases in the last 14 days just in DeKalb County. Okay. The numbers are sure not going down. I mean, they are a little bit better as far as the increasing stability of it, but still, it's we're in this thing, and it's not by far not over. I say that every week because when you see these numbers, when you got 441 cases in DeKalb County, which is just next door to us, and Jackson County with 473 cases just in the last 14 days, it's a lot of people. And those people, they come into our county, they buy groceries, they buy gas here. Hamilton County, a lot of people work in Hamilton County. and live here, and there's people that vice versa that come into our industrial park. And so just be careful. This thing's by far not over, and keep in contact with us, via the internet with Carey and our website. And my number is 423-667-8999. Also my email address is there online too. But just keep in contact with us. We appreciate everyone working with us. Anything that changes, like we can come online in a matter of minutes if we have to. So it doesn't matter, and I know you know that from the reports that we did back when this thing first started. We were doing daily reports. So if anything changes drastically, Carey, she's available. I am. We'll come in and we'll give you notice, and we'll come and keep you up to date on this stuff. So please be safe out there. Wear your mask. Try to do social distancing. And if you need us, just call us, and we'll be back next week, next Thursday, unless we're needed in between. Yeah.